Hello, good afternoon. So today our talk is on chest pain. Chest pain is a very important symptom and there are many causes. We'll go through all the causes and I'll explain to you why it is important. Okay, first a bit on what we are talking about. We are talking about TeraHertz therapy, and terahertz radiation is a radiation that lies between the microwave and infrared region. So the frequency is 0.1 times 10 to a trillion. And so it's a very high frequency, very small waves. And it's primarily used in telecommunication, where they are better than microwave. And I'll explain a bit later. Now the unique thing is that terahertz is the frequency by which all biological substances operate. So, in other words, all biological molecule has a fingerprint on this spectrum. So, here's a diagram that shows you what is known as the electromagnetic spectrum, which span all the way from long waves like radio waves to very short waves like gamma and X-rays and ultraviolet. So all these rays on this end are highly dangerous and toxic because they can cause changes into the cell DNA. So infrared are supposed to be from the sun mainly, and then from the radio waves end you have microwaves. And of course people are familiar with this wave in domestic appliances where they're used to heat up water. So terahertz share the same characteristic in this regard. It can, when it reaches water, it will agitate the molecules and therefore raise the temperature. So terahertz, we only understand terahertz since the 1990s, when there are new techniques developed to generate and detect terahertz. The breakthrough was in 2011 when a very ancient painting, they could shine terahertz on it and they could detect a former painting which was there and the artist's name as well. So last time painting canvases were very rare, and so people tend to paint over old paintings. Now before this 2011, there is known as the terahertz gap. What is the terahertz gaps? The terahertz gaps is here. Longer wavelength on this end, the radio waves and microwaves were studied using electronics. And on this end, visible light is here. All the gamma X-rays are on this side. People studied using photonics, in other words, using light techniques to study. So terahertz is here right in the center. Nowadays, we study terahertz using photonics. And if you keep up with the news, you would know that in China, they're making photonic chips, which are different from silicon chips. Silicon chips are in the electronics domain. Photonic chips are in the photonic domain. So, the application of terahertz, as I said just now, is mainly in telecommunication. If you own a 5G phone, 5G is microwave frequency. 6G is terahertz frequency. 6G is already coming. It's used in military and security because it can penetrate and see through. It's used in agriculture to monitor drought because it's absorbed by water, and in drought there will be very little water detected. In health and sciences, it's non-ionizing. It doesn't damage cells, and because it resonates at the frequency of cells, it is very useful. We look at the healing properties of terahertz to cells. Of course, terahertz shares the same property as infrared. Terahertz is actually far infrared, and the property in common is that it gives heat. When you shine terahertz on your cell, you feel warm. It's because of the heat energy generated. And this heat energy can penetrate, and it can have all the good effects this good effects is not peculiar to terahertz or far infrared, but it's also the same as infrared. Infrared don't penetrate that much, but it does penetrate. So it's a good activities of terahertz due to the heat energy, and that's what scientists will puzzle about. So they remove the heat and leave the terahertz waves there, and it was still able to heal. That's because terahertz heals because of the vibration it creates in the cell, and because of the vibration it was able to heal, and this is the same vibration frequency as the frequency that all cells give out. So as far as health and medical science are concerned, terahertz is used in diagnostic devices and therapy devices. So it's like X-ray, but it appears to be better than X-ray or magnetic resonance, which have been used currently. Slowly it's coming into greater usage, because a lot of it, all the papers on terahertz devices are experimental. So we're talking about therapy devices, and therapy-wise terahertz is useful because of this thing. It's low energy, so it doesn't cause cells to mutate. It is absorbed by polar compounds. Polar compounds are non-conductors of electricity, such as water. Polar compounds are conductors of electricity, such as water. And the energy corresponds to hydrogen bonds van der Waals forces. If you know your chemistry, you would know that this kind of forces are very minute, very tiny, but they hold molecules together. If you look at egg white, for instance, egg white is liquid. Yeah? And when it's cooked, it becomes solid. What is the difference between the liquid form of egg white and the solid form? In the liquid form, the protein molecule, which is a very long molecule, they are folded because of this hydrogen bonds and van der Waals forces. They're folded. And because they are folded, they have a shape. And this shape appears like water. But when you break up all the bonds and all the molecule is straightened out, then it becomes a solid. So it can actually penetrate through solid material, walls, paper, glass, anything. It is absorbed differently by various tissues that are conductors of electricity. Okay? And because biological molecules are all folded into three-dimensional structures, they can change the shape of the molecules by disrupting these hydrogen bonds. Once the bonds are disrupted, like in the egg yolk, it becomes solid. And all this because it resonates at frequencies, and so therefore it can activate human cells. Okay? And that's how it regulates systems, by changing the interaction of the biological molecules. So the effects of terahertz can be summed up on this slide. Open up blood vessels, activate water, activate the powerhouse of the cell called the mitochondria, and hyperactive cells, when there's a lot of inflammation, it can normalize the cells and then it unzip the DNA. So let's have a look at how it opens up the blood vessels. Now, blood from the heart will reach all parts of your body, and because it's from the heart pumps the blood out is under pressure. So at the arterial end, where it is from the heart, there's high pressure and high protein. So oxygen, water, and a lot of nutrients leave the arteries to go into the tissue. So in the tissue, there's low pressure. The oxygen is made use of, the nutrients is made use of, and the water is used for the cells. Then when it reaches the veins, the venous end, water and other things enter the vein. So what enter the veins are the wastewater that carries carbon dioxide, waste products, and all the things that are not wanted by the cell. But because the veins are a low pressure system, not all fluid automatically go in. Not all the waste products automatically go in. there's a lot of fluid and there's a lot of waste products around, and so you have living vessels which are like drainage pipes that drain off all the excess water, all the waste products, all the carbon dioxide back into the heart. So, because TeraHertz can regulate and activate cells and influence cells, it regulates inflammation by activating the white blood cells that you see on this slide. Okay? And that's how a lot of our inflammatory response can be modified when you shine TeraHertz on those parts of your body that are causing you pain or whatever symptoms you are having. The other thing that is important is to activate the mitochondria. Mitochondria is a powerhouse of your cell. Okay? And inside this powerhouse, everything happens. It can regulate your energy pathway. In the mitochondria, there are energy cycles that produce ATP. ATP is the chemical energy that your body uses when you need to run, when you need to do anything, when you need energy, in fact. It can also synthesize amino acids, lipids, nucleotides, clusters, cofactors, everything that your body needs is made and put together in this mitochondria. The DNA will be here. The DNA kind of give you the menu of how to construct the proteins and the different molecules that your body needs, and the mitochondria will make it using the energy derived from this. So a lot of activities are happening on in the mitochondria, which is the energy, the powerhouse of the cell. And among other things, it also causes cells that are no longer any use to be destroyed and absorbed. So all cells have a shelf life. Some cells have shorter life. The longest are blood cells, which is about 120 days. So after that period, they are broken down into fragments, and these fragments carry signals that says, find me, eat me. And they'll be engulfed by white blood cells that are big enough, that have the property of engulfing all these waste products and digesting them and removing them from the body. Another activity of TeraHertz that's very important is that it can kill bacteria, viruses, and microorganisms. And in fact, this is how I get to know about TeraHertz, because during the COVID epidemic, there were reports of people with COVID that recover when we shine TeraHertz on them, and that's because of the way TeraHertz is able to kill the virus. So that is one of the important property of TeraHertz. The other thing is it can open up DNA. If you know enough biology, you will know that your DNA is in a strand, like something like a zip. So the manual, the instructions for what the body needs to do are in the inner side of the zip. So you need to unzip it for two things. One, if you need to duplicate the DNA, you need to open up, read the DNA, and then synthesize the next DNA molecule next to it. Another reason why you need to open up is you want to read the instructions so that you can create new molecules. Okay? So you need enzymes like helicase to unzip it. You need primase, which is to read it and to actually, very much like 3D printing, to put together the molecules so that you get a molecule that the DNA tells you to make. So that's what TeraHertz is able to do. Now, let's come to chest pain causes. There are many causes of chest pain, okay? So, although people, when they think of chest pain, they think about the heart, they think about heart attacks, that's because of the good health education we've been having, because people were dying and dropping off because of heart attacks. Anyway, there are causes in the heart, cardiac causes, including heart attack. There are respiratory causes, that is causes in the lungs. There's causes in the abdomen, and there are causes in the skeletal system, in the muscle and bones. So 3 of 4 major group of causes that can give you chest pain. And we'll go through this in time so that you will recognize them and you can at least have a good understanding when you have chest pain what this is all about. So, because heart attacks can kill so easily, we must consider all the different causes of chest pain. So, this chest pain here can be serious. They're emergent, in other words, when you first occur, it may not appear to be serious, but it can become more and more serious as it develops. So, heart. Some of these are not so common, so I will not discuss this. And in the lungs and in the esophagus. All these are superficial. Herpes zoster is quite obvious, I think all of you know. Thoracic nerve. This one I will discuss. Fracture, of course, you know straight away, you can see. Then some of this I will discuss. Okay, so these are all the causes that you see that can give rise to chest pain. So chest pain is not necessarily due to the heart all the time. Remember that. The chest pain due to heart attacks, there are many descriptions. It's a chest discomfort which is choking, pressing, squeezing, strangling, constricting, bursting or burning. And mind you, chest pain is not the most severe of chest pain. But chest pain is very disturbing. Chest pain due to the heart is very disturbing. When you have chest pain due to the heart, you don't feel like doing anything. It kind of bogs you down. So while not very severe, if it bogs you down, that tells you something. This thing is serious. Okay? And then the location of the pain is very important. It's usually in the midline of the chest. But it can be in the left shoulder or your arm. It can be between your shoulder blades. And there is a sign called the Levine sign. The Levine sign is people clench their fist when they talk about their pain in the heart. And mind you, it's never sharp or stabbing. It's not a sharp pain. It's a very blunt pain. And it doesn't change with position and breathing. If it changes with position or bending or breathing, it's due to some other things. And the unfortunate thing is, it gets better after a few minutes. When you rest, it gets better. And then if you do exert yourself or you're under stress, it comes back again. And usually it occurs in the morning. That's why a lot of heart attacks is in the early hours of the morning. So, but if it's a dull ache that lasts for a very long time, it's not likely to be a heart attack, because your heart attack will improve and then come back again when you exert yourself. Different qualities of chest pain. Muscular pain usually occurs after an injury, a physical injury, and the pain is aggravated by movement. Lung diseases, sharp pain with some breathing or coughing. Lung causes of chest pain are emergencies. You need to go to the hospital immediately, because there's no way you can save yourself. That is a possibility. Anxiety chest pain is the same as the pain of heart attacks, except that it stays in one place all the time and it doesn't get worse, it doesn't get better. Tears, ulcers from either the esophagus or the stomach is usually associated with swallowing. It can range from very mild to very severe. So, how serious is a heart attack? There are two kinds of heart attack. Heart attacks are either stable or unstable. Unstable heart attack means that you will die within a certain period, 20-30 minutes or so, if you are not treated in time. Okay? That's why we learn CPR. That's why for more than 40-50 years now we have direct admission to the ward in case of heart attack. That's why admission nursing, ambulance staff are trained to recognize heart attack because 1 in 10 is pretty high. Okay? But if you are hospitalized, you have a 97% chance of recovery. So that's how much can be saved. Indeed, when we introduced the ambulance service, I believe that was in the 80s, 70s or 80s, that the mortality from heart attack dropped very precipitously because even now, if a heart attack anywhere, there is a lot of defibrillators. You know, in housing estate, you see a box there. If somebody get a heart attack, you can break it, you can take out the defibrillator, and you can cause the heart attack to be reversed fast enough, and then call the ambulance and get a person to the hospital. That's why it's so important. So, heart attack also, if you don't look after yourself, after 1 year, 26% of women and 90% of men died. 5 years later, half of women have died and 36% have died. Risk factors are the usual: smoking, alcohol, cholesterol, blood pressure, all that. What happens when you have a heart attack is that there is a narrowing of your coronary artery. You can see here it gets narrow, 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 and it becomes a complete block. Okay? So this is a stents. It's called an angioplasty, where you put in a netting here and then open up the netting so that the blood vessel can allow blood flow to go through. This is bypass grafting. So this artery is narrowed, right? This is a graft here. Plug here narrowed, so there's a graft here. Where do they get the veins to graft? They get it from your legs. They take a graft from your leg veins and then they put it here. Men usually have heart attacks earlier than women. If you have a second heart attack, you have a higher risk of dying. So, why heart attacks are so important is because people do die. I know that people will say, I have heart attack but I survive. Yes, that's because you have a stable heart attack. How do you know it's a stable or unstable heart attack? You only know after you get admitted to hospital. The other way to know it is you will know if you survive or you didn't survive. So if you didn't get to hospital and you collapse and die suddenly, you have an unstable heart attack. Too late. You don't know, but other people will know that you have an unstable heart attack. If you survive more than 48, 72 hours after 3-4 days, and especially after a week you are still there, and the pain didn't get worse, you have a stable heart attack, if it is a heart attack. So the intervention, PTCA, which is angioplasty or stents, that's what we do. We only do stenting if only 1 or 2 arteries involved. If 1 artery involved, you have a 100% success rate. 2 artery involved, less. When 3 arteries, 75%. So the less artery there are, we do stent. Stent is not so invasive. For coronary artery bypass graft, success rate is very high, but it's open heart surgery. You can open up the heart, get the vein from your legs, and then graft it on. So life expectancy is 18 years, lower risk of heart attack, of death as a result of your heart. But people who do bypass have a lower quality of life. Somehow it makes you slow down. I don't know whether it's psychological or indeed it's physical. So that's angioplasty. In the past we enter the artery through the groin, a long way to the heart. Nowadays we can enter through the hands, enter through here, shorter distance. But the arteries here are narrower, the artery here is wider. Okay? So this is how the stent looks like before it open up. It's like a balloon. So you put in there, okay? Then when it's in position with where the narrowing is, they blow up this balloon and it's there. The plug is compressed and you leave the balloon in place. So in the past, those balloons are not absorbable. If you remember Lee Kuan Yew had stents inserted into his heart. His stent was a non-absorbable type. But 10 years later, all the stents can now be absorbed. So for example, I have heart stents in my heart, but the stents are no longer detectable because they've been absorbed by your body. So as I say, it is very good if you are 1 or 2 arteries, very success rate. I have stents on 2 different arteries. So again, this shows the progression. Blockage, put in the stent, open up the stent, and then the neck is there to hold the thing in place until it's absorbed. So meanwhile, you take medication to make sure that your plugs, your narrowing due to the deposits of atheromatous tissue don't cause heart block again. Very important. That's why you need to take medication for life if you have a heart attack, because you want to prevent that from happening again. You don't want to go in again and again to be stent. So this is a bypass graft, a single graft, 1 vessel, double graft, triple, 4. You can do so many grafts, as many as you want to. It's open heart surgery, you need a clamp to open up so that we can see. So this is another type of clamp. You can see for yourself. It retract, open it up so that you can have a look at it. So in the past we used a heart-lung machine to stop the heart. Now we don't. Surgeons have improved in their technique. The heart can continue to keep on pumping and they can continue to operate and put in the graft. Now that is an advantage because it means that you are not compromised by the fact that you have to divert blood to a heart-lung machine. Cardiac tamponade. This is an emergency. A tamponade is when fluid accumulates in the pericardial space. Now your heart is encased in a fibrous covering, like a canvas like that, the sound surround the heart. Usually between the heart and the canvas there is no space. It is a vacuum, okay? And the heart sits comfortably inside that bag of fibrous tissue. But there's nothing between the heart and the fibrous tissue. In a medical, in a cardiac tamponade, what happens is the fluid accumulate in the space between the heart and the fibrous tissue. So it's a medical emergency. It's an emergency because the heart cannot function. There's chest pain, they can't breathe, they faint, dizziness, palpitation, confusion, agitation, and you got blue cyanosis, turning blue because there's not enough oxygen. It can be caused by accidents, stab wounds, bleeding, aortic dissection where blood get in between the different layers of the walls, heart attack, cancer, anything. Pacemaker infection also can cause a cardiac tamponade, HIV, autoimmune, heart failure. Treatment, there is only one way since fluid accumulates in the space between the heart muscles and the coverings of the heart. You're going to remove the fluid and that is called cardiocentesis. So if you are able to remove this fluid inside this cavity, the outcome is often very good. However, depending on the cause, it may come back again. So this is how it looks like between the heart and the fibrous tissue that holds the heart, fluid build up. So you need to do is punctuate. So healthy heart, the space is almost nothing, no space at all. When it fills up with fluid, it press on the heart, that's why the heart can't function. So this is the pericardium that covers the heart. And yeah. So the accumulation of fluid can take place slowly. When you accumulate over time, then there's chest pain, shortness of breath and all that. When there's a rupture that causes the fluid to accumulate, it can be very sudden and sudden increase of pressure, sometimes they're caused by trauma, accidents, and then you can get a heart attack suddenly. So therefore, it is considered a medical emergency. So it's not always a heart attack, or a heart attack may not just be a heart attack, because a heart attack can be caused by the acute tamponade, especially if it is after an accident. And this is an emergency. You need to go to hospital. You can't stay at home and expect to survive. Now we talk about the lung causes of chest pain, and this includes pulmonary embolism and pneumothorax. Pulmonary embolism is a blockage of the arteries in the lung by a substance from somewhere traveling to the lungs. So the most common cause of pulmonary embolism is deep vein thrombosis. Okay, so you have bloody cough, irregular heartbeat, fainting, dizziness, sweating and all that. How fast you recover depends on, number one, how severe it is and how soon you get to treatment. Untreated, you have a chance of 30% to die. If treated, then you're more likely to survive. 92% survival rate. But you need to take medication, possibly lifelong, because if blood clots can happen, there is a possibility that blood clots can be repeated again. So, the blood clots can be from your legs, deep vein thrombosis. That's why nowadays we encourage people to make sure that their muscles are contracting by exercising their legs and walking around. But of course during turbulence don't walk around. The whole idea is to make sure that the muscles are contracting and then blood are flowing so you don't cause a clots. Clots occur because when blood flow is slow and reduced in the legs, blood clots begin to accumulate. So when you have a embolism, wheezing, pain in the calf, coughing, coughing out blood, chest pain and sudden shortness of breath, how do you deal with it? Anticoagulant drugs, thrombolytic drugs, compression, stockings can help, surgery. You can remove the veins and the clot fragments and prevent them from reaching the heart. Pneumothorax, this is very important because this is very easily treated. Even ambulance staff can handle it if they can recognize it, and it's not too difficult to recognize. Okay, it's quite easy to recognize, but you must be able to recognize it. Pneumothorax is when you know that your lungs and the thoracic cavity which the lung is in, there is practically no space between the lung itself and the cavity which the lung is in. Okay? In the case of pneumothorax, air gets into that space and compress the lungs. Just like in cardiac tamponade, the water compresses the heart. So here, the air compresses the lung. The lung collapse is a medical emergency because your lung cannot function. When your lung cannot function, no oxygen is captured from the air and no oxygen is taken in, and it's often the result of trauma or fracture or while taking a biopsy. It can be a complication of lung disease such as asthma or TB or whatever. It's called tension pneumothorax because wherever the injury is, air can get into the cavity, the pleural cavity, the gap between the lungs and the thoracic cage. Air can get in, but it cannot come out. So it cannot escape, and so as a result, the air inside the pleural cavity increases, pressing the lungs and causing symptoms, pain, breathing, cough, fatigue, cyanosis, rapid pulse. Treatment, you need to release the gas and you need to give oxygen so that the patient can survive. So this is what it looks like. See this one? The lung is in the thoracic cage very nicely. There's no gap between the lung and the thoracic cage. Here, the gap between the lung and the thoracic cage is filled with air. So here, more diagrammatic. Air is it, and you're going to release the air inside here. And how do you do it? You puncture it. Push a needle in, and once the needle is in, air can start to come out. So it's a very simple procedure. If you recognize it, all you need to do is take an injection needle that's fairly large ball, push it in, and you can hear the hissing sound of air coming out. That's why even a medic can do it. And how do they recognize it? Tap on the spot. Okay? If it's solid lung tissue, it will be solid low frequency. You tap on it, it sounds hollow, high frequency, like as if there's air inside, you know this is a pneumothorax. Okay? So once you puncture it, you want to keep the needle then for some time because you want to collect any fluid that may be coming out. And then meanwhile you give oxygen. So this is normal. See, there's no gap. This is abnormal. This is pneumothorax, where air is inside. Air can't leave. Pressure on the lungs, trachea, heart, and other structures. Symptoms: can't breathe, chest pain, blood pressure down, heart rate goes up. And what you need is to decompress it. That's what is being done here. Decompress a pneumothorax. Okay? So most of the time it's due to injury, like accidents, fracture ribs, things like that. That's why air got introduced. But it's quite easy to recognize and very easy to handle. Okay? So we have dealt with causes in the lungs and in the heart that causes chest pain. Now we deal with causes in the esophagus and the stomach from the abdomen. Okay? They're important causes because many years back I happened to treat somebody whose husband has gastric. So see a gastroenterologist, went in, gastroscope a few times, never recovered, eventually he died. He died of a heart attack. So a heart attack can mimic gastric symptoms. Conversely, gastric symptoms can mimic heart attack. It's both ways. So in doubt, always check the heart because you can die from heart. So reflux disease, GERD, is a flow back of gastric juices into the tube lining the esophagus. And you know the esophagus continue all the way behind the heart, up in the thorax. A lot of people experience mild symptoms and heartburn. Heartburn. It's like your heart is burning. So ordinary lay people cannot distinguish the cause of the pain. They feel pain around the heart area. And it can be due to many things. And sometimes, like I say, you have more than one condition coexisting together. You can be having gastric and have a heart attack. Or you can have just a gastric that give rise to GERD or whatever. And the thing is, if you have food with the acid taste, obviously from your stomach, and it's behind the sternum. So sternum is in the center of your thorax. So it's very hard to distinguish vomiting, coughing, breathing, and all that. It can be mistaken for heart attack. Of course, it can occur at the same time. So depending on symptom, check whether there's heart attack, check whether there's something like a GRD or whatever. Treatment is usually by means of medication or triggered by certain foods that are spicy or acidic in quality, and treatment often is very successful provided there is you have ruled out any heart attack, and that is very important. So acid in the stomach, it can go upwards. That's what GRD is about. Food, acid and digestive food. There is a valve here between the stomach and the esophagus. This act like a valve is supposed to stop the acid from going out. But when this is not able to go up, then you get a problem. You get the acid going up here, and that's why you got heartburn. So these are all the symptoms associated with reflux disease: heartburn, chest pain, nausea, bloating, gas, belching, certain food intolerance, difficulty swallowing, food coming out, digestive foods, sour liquid, which is acid, sensation of a lump in your throat, disrupted sleep, worsening asthma, laryngitis. Laryngitis is a very common symptom for GRD. So causes: poor diet, obesity, unhealthy lifestyle, too much alcohol, cigarettes, pregnancy. Pregnancy is a solid obstruction that's pressing on your stomach. Eating too close to bedtime and certain medication can cause it. So this is from the abdomen. It can also cause heart attack, but be sure, because heart attack can kill, make sure you exclude the heart attack. So acute gastric ulcer. Gastric ulcer is when there's a break in the lining of the stomach. It's also called peptic ulcer. It's associated with an infection called Helicobacter pylori. Usually associated with excessive drinking, certain drugs, smoking, stress. So the symptom is again heartburn, acid, and all that. There is a condition called Zollinger-Ellison syndrome. This one, your stomach produces a lot of acid because there's an abnormality in your hormonal profile, and this causes the secretion of stomach excessively. When you have a lot of bleeding, of a lot of acid, chances are there's bleeding, there's perforation. These are the two complications. So excessive bleeding can lead to shock. Perforation. Perforation means that the break in the skin penetrate all the layers of the stomach right through. So there's a hole from the stomach leading into your peritoneal cavity. And of course it's aggravated by all these things, alcohol, smoking, and certain foods. So, bleeding gastric ulcers and perforated ulcers are emergencies. And so a lot of conditions that give rise to heart pain, chest pain are all emergency conditions. Bleeding gastric ulcer requires blood transfusion, without which you can't survive. Mortality from bleeding up to 30 days, in other words, 5 to 12% of people who suffer from bleeding gastric ulcers can die because they lose too much blood. And that occurs when bleeding control fails in 30%, death within 48 hours. So in order to control the bleeding, there are two things that doctors do. Number one, replace the blood. That is very important because blood carries oxygen, nutrients to all parts of your body, without which you will die. So you need to replace the blood that is lost. So if you lost so much blood, you will pump in so much blood and fluids. And then you will make sure that clotting take place. Clotting seal any damage and prevent further bleeding. So say bleeding is from, usually bleeding from gastric ulcers and some other conditions, the bleeding is generalized. That means it is like erosion, various parts of the lining of the stomach get eroded, and so the bleeding are in tiny spots. So you want to stop the bleeding. If it's a big area, you can put in a gastroscope, and through the gastroscope maybe put something on the thing to stop the bleeding. But if it's an erosion where all the minor bleeds all over the place, you need to put in clotting factors and platelets to seal the block, to prevent further bleeding. Then the patient will survive. And that's very important. So that occurs when bleeding control fails, and that occurs in up to 30%. Age is a predictor. The older you are, the more likely you will be not able to control the bleeding. So overall mortality, so perforated gastric ulcers are when the acid has penetrated through all the walls of the ulcer into the abdominal cavity. Okay? And in the case of perforated gastric ulcers, 24% will die. That's 1/4, 1 in 4. That's pretty high. Gastric ulceration, 40% mortality, coming to about less than half. So leaks of gastric juices into the abdominal cavity require emergency treatment. So these are all the ulcer types. This is a stomach ulcer, looks like this is a Helicobacter pylori, the bacteria that cause ulcers. The different layers, and it can be quite bad. So if it's bleeding gastric ulcer, blood transfusion is necessary, as well as all the clotting factors to prevent further bleeding. So how much you transfuse? 3%, threshold 9%, and so on. 45% mortality, people can die. If this is if your hemoglobin is less than 77%, usually for a male the hemoglobin is about 14-15% grams percent. For a female it's slightly less, 11 or 9%. If for a male 14%, you are less than 7, that's you lost about half your blood. If you lost about half the blood, the chances of you dying is very high. So if it's less than 9%, then you lost about 1/3, it is slightly better. One reason why I retired was because I have a bleed up to about 9 mg/cent. So I could have died. I'm thankful that I survived. So that is bleeding gastric ulcer. Perforated, in other words, you go through, there's a big hole, all your stomach contents get emptied into the cavity. It's all over the place. So what do you have to do? You're not only having severe pain, but your stomach is frozen. A condition called peritonitis. So you need laparotomy. And during laparotomy, not only they want to close up the hole, but you need to wash the abdomen through. So you put saline in the abdominal cavity and use a tube to suck up all the saline out again. In other words, wash it thoroughly, make sure that no food particles or whatever is left in the abdominal cavity which can cause infection. Put a drain in to drain it. So it's a long surgery. There is a lot of mortality associated with that. As you can see, 1 in 4 can die. this is interesting. This is a rupture cervical disc. That means in your neck area there is a prolapsed disc. I must say that this is a very rare cause of chest pain. Rarely a chest pain is caused by a prolapsed disc, but it can happen, and it's also an emergency. Because your cartilage rupture, the gel that is in the disc press on the nerve and the spinal cord. There are 6 discs in your cervical column. You cannot function, you cannot move. Life is at risk. Your life is at risk because if you press on your spinal cord, you will end up with paralysis of both your hands and legs. Your total body paralysis. If you press on the nerve, you will get pain in your hands. Radiating arm pain, shoulder pain, numbness, tingling of arm and hand. If you feel that, then it is the pressing on the nerve that supplies this. So if you press on the spinal cord, it causes cord compression, paraplegia, in other words, all 4 limbs are paralyzed. Inflammation accompanying this will cause damage to surrounding tissues and nerves. I want to emphasize again, this cause of chest pain rarely occurs. Rare doesn't mean it never occurs. It can happen. So, herniated cervical disc can cause severe chest wall pain, crushing in character, very similar to angina, which is chest pain due to heart disease. So, that's why not all chest pain are due to heart disease. Associated symptoms include breathlessness, nausea, sweating, neck pain, and all that. It sounds very much like heart disease. And that's why we have to be careful. Conservative treatment with neck collar, pec traction, exercise, and all that. The treatment with relaxants, painkillers, and at least 3-month treatment, if not longer. So, your chest pain can be due to your neck. Not common, but it can happen. So here you can see it press on the spinal cord. Here it press on the nerve coming out. So you wear a collar or you do traction. Very simple immediate treatment. You can cure this. Otherwise, if you give rise to chest pain and you can't recognize it's due to your neck, you can die from it, or you can end up with paralysis. Next, this cause of chest pain, 100% survival. You will survive. You will never die from it. And the thing is, it's very, very common. In fact, most of the chest pain seen in emergency are due to this. It's called a chest wall pain syndrome or costosternal syndrome. It's a cartilage connecting your rib to your sternum, the breastbone. It's a sharp pain in the chest wall, going all the way to the back or to the stomach. And the pain is worse when you're breathing or when you're coughing. And when you press here, you can feel that it is painful. So it can be caused by injury, heavy lifting, strains from coughing, infection, arthritis. A lot of things can cause this kind of pain. It's not serious, improve with rest. You can do cold or hot therapy, local anesthetics, you can take painkillers. It doesn't matter what you do, you'll get better. That's the good news. So there you are. This is where it is painful. And as you can see, the heart is just behind the rib cage. That's why when this is painful, people think, oh, it's the heart. But it may not be. So this is where. So, as I said, majority of chest pain seen in emergency is due to this. It's very common. So is it costochondritis or heart attack? If it's a very sharp pain and it relate to your movement, it's not likely to be a heart attack. If it's not such a sharp and excruciating pain and it improves when you rest and then it comes back again, is more like a heart attack. So that's the difference. Okay? So how do we handle chest pain? I will never advise that you just use TeraCare or any TeraHertz device straight away, because many causes of chest pain are emergencies. Even if you don't want to, you can do the blowing with iTeraCare, but the first thing is get to hospital, get it evaluated, get a medical opinion. Better be sorry than be dead. Okay? So after medical evaluation, if it's non-serious, by all means take all your supplements, use your iTeraCare to the fullest, but listen to medical opinion. If it's the chest pain is due to your heart, the doctor will ascertain whether it is stable or unstable. If it's unstable, stay in hospital, get yourself treated. If it's stable and you can afford the luxury of waiting, then by all means do anything you can to reverse it. And there are people who have reversed it. You know, I know of one fellow who didn't want to go for any heart bypass or stent or whatever, because his heart attack was stable. So he stayed at home, he moved, he exercised as much as possible up to his ability, and he survived. He survived better than his wife who died earlier of a heart attack. So you can survive if your heart attack is stable. But if it is not due to heart attack, it can be any of the other conditions, especially if you're involved in an injury, which can give you a cardiac tamponade or a pneumothorax. Then you deal with it accordingly. So if you have risk factors such as smoking, alcohol, obesity, and blood pressure, make sure you take your medication regularly. And if you are not exercising, start exercising, be positive, do all the right things to help yourself. That's how you handle a chest pain. Never take it in your own hands and be the doctor to yourself. You can't be a doctor to yourself. You need somebody to give you an objective opinion. TeraHertz, as far as pain is concerned, TeraHertz, we recommend it for pain. Well, it can be used for pain. Chronic pain, bones, muscles, soft tissues. And for this kind of pain, it's very effective. Chest pain, if it's acute and severe and debilitating, pay attention. Get a medical evaluation. Even if it gets better temporarily, if it comes back again, seek help. Because what did I say? Pain due to heart attack are not very severe, gets better with rest, comes back when you exert yourself or when you are stressed, and then you rest again, it gets better. When you see this pattern, make sure you get properly evaluated, because people have collapsed and died from heart attacks. Deal with the cause of the pain. That's important, because as I have shown you in this talk, the cause of the pain can be due to so many things. Okay? When the pain is chronic, iTeraCare can increase the blood flow, reduce the inflammation, reduce the swelling, and regulate the activity of nerves. And that's how your pain can better. If it's chronic, properties of TeraHertz allows for repair of tissue, causing tissue that are damaged to be destroyed and removed, and increase stem cell activity. Often, pain requires different approaches to it, especially with a number of especially if there's a lot of underlying medical conditions. So a lot of the pain, the chronic pain, including chest pain, not due to cardiac or the serious causes I talk about in this lecture. Chronic pain due to muscle or tissue or bone cannot just be relieved by one thing and one thing only. You often need a lot of things. Often there's an underlying factor, obesity or diabetes or whatever, and you need to deal with the underlying condition. That's terribly important. So you find these are all the TeraCare adverts on the internet. Back pain, neck pain, leg pain, shoulder pain, joint pain, muscle pain. These are all muscle and joint pains. That's what iTeraCare is good for chronic pains, not for acute, sudden pain or sudden onset, especially if it sounds like heart pain or one of the conditions that is serious, which I have talked about here. So I like you to pay attention to this fact. If it's chronic pain, by all means use TeraHertz. You have it, you never get well, you don't seem to get well, use it, you'll get well. But if it's more than that, please take note. How about stem cells? Stem cell can heal and regenerate tissues, especially damaged tissue. It can replace dead tissue with live one, and there have been many reports where dead tissue have been replaced by living tissue which are functional. Like Parkinson's disease, you can replace the dead neurons with fresh neurons that don't have the condition. Heart disease, the scar tissue can be replaced by heart muscles, and so on. So it can remodel your damaged organs. I like this word, remodel. It means that it can give you a new heart, a new nervous system. Combined with iTeraCare, it can make you reverse your biological age. iTeraCare works together with stem cell. People say iTeraCare activates stem cell. Yes, it does. It becomes more active. So it's useful for chronic pain with underlying degenerative disease. So at this point in time, I want to tell you that stem cell nutrition and stem cell therapy are available for this purpose now all over the world. Just seek the right doctor or physician who can give you this. And if you want to, you can also contact me and I will help you to get access to this. So this is what stem cell therapy about. The different type of stem cells can allow you to be healed. You can inject it into your bone. Those with eye problems can inject it into the eye, knee. Stem cell therapy for pain relief is a regenerative treatment that involves stem cells to promote the repair response of disease or injured tissue and the growth of new tissue. So there you are. Wherever you are, wherever the body tissue will be, there will be stem cells, and TeraCare activates stem cells. And so TeraCare and stem cell treatment goes hand in hand together. And today's stem cell treatment is one of the cutting edges of medicine. So how do we get ourselves to recover completely? Being mindful, being aware of what is happening to your body. Don't just eat, drink and be merry. Right? And be grateful. Gratitude helps you to be positive, and then you can achieve things in life. So this is what a balanced lifestyle is. Healthy, happy mind, good healthy habits, fresh food, adequate exercise, positive outlook, spend time with people, and be connected. Make your life meaningful and joyful. Live out your purpose in whatever you do. So, a reminder, iTeraCare is useful for various inflammations, pains, blockages, and skin especially. So, we have talked about a specific type of pain, chest pain, which is not in this list, by the way. You notice that chest pain is not in this list because chest pain can be serious. Okay? So not recommended. All I have to say is that open wounds or fracture, you can use iTeraCare. All I can say is that object implant, you can use iTeraCare based on what expert opinions are saying on the internet. So that's it for now. So this is a bioresonance therapy that I use to see whether which part of the body is functioning properly. And here you can see that the bioresonance is scanning the heart. You can detect whether anything is abnormal with the functioning. It scans the entire body, and with